In 2022, Cornwall and the Isles of Scilly commissioned a piece of work by the Health Innovation Southwest to discover what infrastructure was in place across Cornwall for quality improvement, or QI. Following the work, there were two suggested routes. One was to utilise QI as a system approach to a piece of work, and the other was to organically grow our QI culture through a variety of cultural elements, such as training, events, and social media. I created a proposal for QI Cornwall to be created. This project was with a focus of further nurturing a learning culture in Cornwall, building upon our in-house skill sets and to foster a greater collaborative working in our health and care system for the benefit of our Cornish community. We recognised that there were several different areas where we were already trying to work more collaboratively in our system, but these were acting in silo. This launched our vision for QI Cornwall. We wanted to share one vision for QI in Cornwall that could be adopted across our health and care system. The aim was to bring together existing QI professionals and enthusiasts from across our health and care system to share learning, best practice, and spread QI capabilities and skills to create a recognised QI approach for Cornwall.
So like embedding a systematic and continual improvement process across the system would mean a workforce constantly looking to improve the quality of all interventions. And evolving that QI Cornwall would mean a system with a shared purpose to foster maybe a training hub, a community of best practice that allows us to embed QI in all aspects of work and to share that knowledge and that cross-fertilization of ideas and learning. I guess the good news is we have existing QI professionals and enthusiasts already in the system, and really having a space where we can supercharge their work to get that partnership working and that shared learning of resources across the system would be really powerful, and I think would make a massive difference to reduce health inequalities in access, care and experience across the system.
So for us in Cornwall and our community hospitals across Cornwall and the Isles of Scilly, we find that embedding quality improvement really helps us to kind of embed that sustainable change and make sure that the changes that we are making kind of have a big impact and can support us to support our local communities. So for us, place-based care is really important, and embedding some of that QI work helps us to kind of challenge those health inequalities and make sure that there is access for all. So especially for some of our remote areas like the Isles of Scilly, it's making sure that we can have kind of sustainable change in those areas and build that kind of capability, knowledge and skills as well within those areas, so that they're kind of self-sufficient as well and can carry on with that work that they're doing.
Yeah, so the reason I love QI is because at its heart, it's all about helping people to make improvements. And we've got so many fantastic examples of QI within our CHT and across our health and care system. And so what I think is really exciting about QI Cornwall is it gives us an opportunity to create something that is bigger than the sum of its parts. So by bringing people together who are involved or interested in QI, we'll be able to help build a community where we can support, develop, share QI practice, and create a QI community that can do far more in spreading QI culture than any single organisation could ever do. And then I think through that, we create a network to support anyone working anywhere across our organisation, across our health and care system, to improve things where they work for themselves, their team, their patients, their service users. And I just think that's hugely exciting for Cornwall.
Work within integrated care areas and with a really wide range of stakeholders and partners. So, for example, I'm doing a lot of work at the minute with our BCSE partners, and I think there's undoubtedly so many opportunities for quality improvement, and in many cases a real appetite to use quality improvement, but there is a gap in how do we access quality improvement resources, where can we get training, where can we get support, and where can we get expertise. So I think to have that really established common approach across all of Cornwall to access tools and techniques would be an absolutely fantastic benefit and really, really worthwhile.
QI Cornwall is about creating one shared vision for improvement in our Cornwall and Isles of Scilly system. We envision that by working collaboratively, all of our health and care system would be able to have access to our QI training, resources, platforms to share and celebrate their work, improve upon services provided to our health and care system, and ultimately make progress to providing better care to our whole community. Developing QI Cornwall means all aspects of our health and care system could work collaboratively, improve capabilities, improve processes and systems to give our patients what they need in efficient and effective ways. By using improvement methodologies, everyone would be able to make sustainable changes for Cornwall.
And I think a QI approach will really help us bring together and support that sort of collaboration of all those organisations and individuals to sort of promote integration and help us sort of improve sort of the health and outcomes of our sort of population. I think the QI approach will also sort of help us bring together a sort of common language and common approach, so we all know what we're sort of talking about.